for a great introduction, and thank you for your amazing troubleshooting ability with the migraine stuff. It's really impressive. And you mentioned before that we with ICIM, we really have the best of both worlds here, and I really feel lucky and privileged to be here and learn and share what I've learned. Just out of curiosity, everybody got a syllabus, and I know it's densely packed with information, but who had a chance to read, the part that I'm about to present? Anybody? Okay, that's fine. I just want to have an idea. So really, it'll be new information to everybody. Great. So Dr. Sika mentioned everybody's atlas, C1 first cervical vertebrae, is more or less out. It's in a malrotated position. So well, not quite everybody. We had a few people here yesterday had a treatment done, and we'll maybe talk to them a bit later. But everybody's C1, first cervical vertebrae is out, and you might say, well, if everybody has that malrotation, so what? No big deal. Well, it's actually wreaking havoc in the body and causing pain, and I'm going to get into that in the next 30 minutes or so. We had a colleague of ours had a patient a few years ago. He was a neurologist, he was a neurosurgeon and a radiologist, and he had migraines. So he came because he heard that the Atlasprofilax treatment helps with migraines. And the colleague, the therapist, told him that everybody had this malrotation of C1, and he kind of laughed and he thought that was ridiculous because him as a radiologist, he certainly would have seen that and noticed that. But he was intrigued because his headaches went away, and he started looking at images, and he found that all the images he saw that malrotation, typically left forward rotation of C1. So this patient was Dr. Rainer Seibel, and he has a pretty impressive resume. Let's see, and he started investigating the method. So over a period of 5 years, he investigated the method, and he wanted to determine if A, it's true that everybody has this typical malrotation, and he wanted to see if Atlasprofilax really corrects that malrotation. So he was determined to find that out, the position of before and after method, and he looked at 114 volunteers. He did a CAT scan, so three-dimensional color images, and he found that virtually everybody had the malrotation before the treatment, and 100% of the patients had the atlas in an anatomical correct position after the Atlasprofilax therapy. So we're going to see some of those images. This is the three-dimensional CAT scan that he took, and you can see the tilt of the atlas and subsequently the tilt of the skull and the compensation pattern of the spine. It creates an alternating pattern in the spine, a zigzag pattern. And chiropractors know this, and they know usually where to look for these subluxations before you even get to them, because there's common patterns in the spine. So this is clearly shown. Also in the past, chiropractors and doctors also thought that maybe the compensation starts from the bottom, from the sacrum and the pelvis. And if the pelvis is rotated, it'll create an upward pattern. But in fact, the force of gravity is downwards, and the weight of the skull creates a zigzag pattern from the top down. Here's another image that shows the tilt of the atlas. You can see that one of the arches of the atlas is not shown. So it shows an inclination of the atlas. So we're going to look at some more images here. We see the condyles, the joint surfaces of the skull and the atlas, and the atlas and axis they don't fit well. But you can see that the axis doesn't support the atlas very well in that image. And you can see the tilt again, the tilt of the atlas and then the skull too, and the deviation from the midline. You can see how the whole head is tilted. Here's another image that shows the MRI that shows the before and after. Before, you see the lateral mass of the atlas in a typical left forward rotation, and then on the other one you see the symmetry of the lateral mass of the atlas. Nicely there. Here's one more image on the side. You can see the atlas moving forward. Okay. So we're going to talk about the impact of that, and we talk about. So we see that we're going to talk about everybody's atlas is out, the impact it has, and how to correct it. The good news is it's an easy, quick, and safe solution to that. We're going to look at a biomechanics of the spine a little bit, just as a reminder. So we have the atlas that holds the head. Atlas is named after the mythological figure, the atlas that's holding the world on his shoulders, or maybe on his atlas. And today we hold our world on our atlas. the compensation of this injury, we call it an injury, the malrotation of C1, is actually at the L4, L5. And you might say, why, that's, it's a strange place to compensate for an injury. But if you imagine the atlas rotated and tilted, it makes the head fall forward, and when the head falls forward, it's as if somebody's applying pressure to the back of our head, and you can see that that will create tension in the lower back, right? So that forehead posture will flatten the lumbar lordosis and create tension in the lower back. So immediately after the treatment, we have a relief in the lumbar region, and actually the center of gravity moves from L4, L5 to L2. Dr. Elizabeth, thank you.
I got a treatment yesterday, and I can tell you that I'm taller as a result of it, and I can tell that I was standing straighter. I had to force myself into a nice posture before, and then afterwards it was just easy for me to stand up straighter, and that's really important to all the dancers like me.
Thank you, Dr. Elizabeth. Thank you very much. So we also know that when the atlas is in alignment, the shoulder and the waistline is in alignment. When the atlas is rotated, we have a typical drop shoulder and rotated and drop pelvis, which creates a functional leg length discrepancy. And immediately after the treatment, we see a reduction or elimination of the leg length discrepancy. So we're going to look at the atlas. The asymmetry of the atlas was thought to be maybe an asymmetric bone, because a couple of studies were done, they couldn't find a symmetric atlas. So there's a couple of interesting things about this image. First of all, it's a 5,000-year-old atlas which shows the malrotation, and what that tells us is that the malrotation is not a modern day problem. It's not because of our sitting and habits, or even birth, the way we're delivered with the pulling and twisting of the head. It's probably not caused by that, because it dates back at least 5,000 years, the malrotation, and we can see the joint surfaces are asymmetric there. There are a couple of studies done that verified the asymmetry of the atlas, and they came to the conclusion that the atlas is an asymmetric bone because they couldn't find a symmetric atlas. But it's probably that the malrotation wore the atlas out and caused it to be asymmetric. Decades of wear and tear. We're going to look at a couple more images. Traditionally, chiropractors and practitioners looked at they want to look at the atlas. They had this AP, anterior posterior X-ray images, open mouth, and you can see this is a good example of a bad X-ray. You can see that you can't really see much. You can see the dents in there, and you can see the lateral mass of the atlas, and you can see the gap is a little bigger on one side than the other. And many early treatments were based on that. The atlas doesn't have any disc above or below it, so it was never really considered as a cause of an injury or ailments or pain, unless it was broken, obviously, or something like that. Here you see the side view, and again, the side view shows like maybe a flattened cervical curve, but wouldn't really show a malrotation of the atlas. Actually, this image shows. You can see the tilt of the atlas because you can see both arches, both posterior arches of the atlas pretty clearly, which would suggest that the atlas is tilted. Here's another image showing the tilt of the atlas and the rotation. So we see that the atlas is rotated with everybody, and then we obviously begs the question, why? Why is the atlas rotated? So we're going to look at it shows a typical forward rotation and the diameter of the magnum foramen is reduced here. And just as a reminder, just really quickly, anatomy, how it's supposed to look like the bottom of the skull of the atlas, how it sits. And we're going to talk about the etiology of the injury. It's probably a genetic cause. And in this whole presentation, this is the only sentence in the presentation that hasn't been verified. Obviously, we didn't do CAT scans on fetuses, and we don't know when the malrotation occurs. The HOX gene is part of the homeotic gene group that carries information of the location or the position of vertebrae. So it probably carries information for malrotation. But again, this is a theory. But almost certainly during delivery, that injury, the existing injury, is worsened. We can see if everything goes best case scenario in the top picture with the delivery, there's still a pulling and twisting of the head. And if you imagine that the neck is injured, certainly that would worsen the injury. And obviously, if the birth is difficult, then we will have that injury worsen a lot, obviously. And a secondary etiology is mainly whiplash. So we have the car accidents which make the malrotation worse. And then, a few months later, we have a late onset of neurological problems because of compensation mechanism for that injury. It's great. The elasticity of the vertebral arteries, and the body can compensate that injury, but not for long. Also, falls, obviously, even a fall, on the sacrum can transmit the forces and cause a malrotation of the C1. Also, sometimes inflammation, though. Let's look at the impact of this malrotation. So it affects really all the systems in our body. Let's look at the neurovascular impact. So we have irregular jugular openings, meaning the blood doesn't drain properly from the brain. We have a constriction of the cranial nerves. Vagus nerve is obviously, everybody knows, most things that happen in front of the body are regularly better than vagus nerve. And we have amazing results with things like thinking, thyroid function, breathing, tachycardia, heart rate, digestion, elimination, reproduction. We have interesting results with those. Hypertension. A malrotated atlas can cause pressure on the vertebral arteries, and the baroreceptors there would indicate that the brain is lacking oxygen in blood, and would increase, therefore, would cause an increase in heart rate, and could cause hypertension. So the cause of hypertension could be in there. I had a meeting with a cardiologist last week, and we talked in depth about that. Migraines, vertigo, insomnia, all these things are probably related to a reduced oxygenation of the brain, or a fluctuation in the oxygenation of the brain. We found that when the oxygenation fluctuates, it can cause these things and interrupt sleep cycles as well. A couple more things on this list are Parkinson's disease. I will talk about that a little bit later, and multiple sclerosis. Both of those probably have to do the lesions are causing the brain, possibly due to the brain not draining properly, and the blood pooling, toxins, specifically the irons pooling in the blood and causing these lesions. I did a lot of work with the Multiple Sclerosis Foundation in Croatia. All this was televised, and we had amazing results. We had treatment early on. Many patients were asymptomatic. So definitely cause and effect there. We'll look at the physiological implications. So we have an uneven weight distribution that causes a dominant effect in the spine. Essentially, the body is slightly pitched forward to the side. Again, if you were to imagine the center of gravity as a dot on the floor, it would be forward and to the right in most cases. So the center of gravity will be restored, and then the muscular compensation would be reduced. Our skeletal muscles, we know, are mostly for locomotion and generating heat, if you call it. That's why we shiver, right? So they're not for keeping us from falling over. So when the atlas is out, we have a forward head position, which causes the whole body and back, the muscular chains to tighten up and cause inflammation, trigger points, etc. And immediately after the treatment, we have a more relaxed upright posture, as Dr. Elizabeth told us. This does immediately. Interesting results with myofascial syndrome and fibromyalgia in terms of the muscular compensation, but what it says here, it's usually the secondary cause, which is trauma, which makes the atlas in a more malrotated position. Dentistry. We worked with many dentists. The transverse process of the atlas because of mechanical interference with the TMJ and the lateral pterygoid muscle. So bruxism, occlusion, just pain and discomfort in the temporomandibular joint. We have fantastic results with that. Really, in most cases, immediate results. I work with many dentists, and we're obviously recommending the treatment Atlasprofilax before dental work is done. So now you're asking, how do we know the atlas is out? How do we determine the atlas is out? We don't use X-rays or any thermal instruments or any imaging. We use kinological tests. So we start with palpation. We test